So hi guys, let's talk about pneumonia in an adult. So these are consolidation of the lung parenchyma due to infection. Clinical features include breathlessness, cough with or without sputum, which may be rusty in color, fever, pleuritic chest pain, bronchial breathing, reduced chest movement, reduced breath sounds, tachypnea, crackles, and percussion dullness. Features less pronounced in elderly patients. So clinical features we categorize into two, primary and secondary. Under primary, it's occurring in previously healthy persons living in the community. This is usually lobar due to pneumococcus, usually a very short history. For secondary, it develops as an association with prior respiratory diseases, and it occurs in immunocompromised patients, alcoholics, and postoperative patients. Investigations involved include a hemogram, whereby we check the PBF and WBCs. We do a sputum for microscopy, we do a chest x-ray. Let's go straight to community acquired pneumonia. So this is basically managed at an outpatient level, and we give IM benzyl penicillin 2 mega units start, then amoxicillin 500 milligrams TDS for 7 days. So if penicillin allergy is present, we give erythromycin 500 milligrams QID for 7 days, or we'll alternate with another antibiotic such as cotrimazole. Also give analgesics, that is paracetamol or acetylsalicylic acid. And for inpatient services, we admit a patient in case the patient has cyanosis, respiratory distress, that is respiratory rate less than 25 breaths per minute. Patients who have heart failure or pleural effusion, more than one lobe is involved, poor response at outpatient level, and patients who are dehydrated. Also, secondary pneumonia, when it is suspected, we admit the patient. So after admission, we give IV or IM crystalline penicillin 2 mega units, QID till there's response, then discharge on amoxicillin 500 milligrams TDS. So if allergic, give erythromycin 500 mg, QID or cotrimazole for 5 days. So if there's no response, you consider investigations for TB. So when you're managing secondary pneumonia, we admit a patient and treat with the benzaline penicillin, 2 mega units IM or IV 6 hourly, combined with gentamicin 240 milligrams IM or IV once a day for 5 days. Or we can give ceftriaxone 2 grams every 24 hours, or erythromycin 500 mg 6 hourly for 5 days. So in case of aspiration, we add metronidazole 500 mg IV 8 hourly, or use comoxiclav 1.2 grams 8 hourly in place of benzaline penicillin. So if staphylococcus is suspected, add fluoxacillin 500 mg IV 6 hourly. As a special precaution, consider pseudomonas and staphylococcus. So prevention, we give pneumo vaccine to those who have sickle cell diseases and with impaired spleen function. Thank you very much. I hope you can manage our patients way better. Have a nice day.